Yeah. Well, welcome everybody to Upland Chamber's August luncheon. I am Dory Ferranto, current chairman of the board. My business is Assistance Insurance Agency, and I'm so glad to see you all here. Today we are sponsored by Insurance Agency de Aragon, Anthony Aragon. Hello, Anthony. Well, now that the meeting has started, here's some Zoom meeting rules or etiquette. We will have everybody on mute. You could raise your hand if you'd like to speak. And in fact, hold on a minute, I need to put that there. We will have two presentations today, one from our sponsor, Insurance Agency de Aragon, and the other from Filiberto Quintero, U.S. Department of Labor, Wage, and Hour Division. And we'll be doing, hopefully, our roulette wheel spin for the networking at the end of the meeting. So very fun. If we have any Upland board members here and ambassador team, give a little wave out. Hello. Thank you so much, everybody. We do have Suzette Dang here from Supervisor Kurt Hagman's office, and we have Mayor Debbie Stone. Is she on? I only have one screen.
Yes, so, I'm here.
Oh, hi, Debbie.
Hi.
So welcome, welcome. We do have this thing called Chairman's Circle, which I'm sure you're all familiar with because I talk about it every time. It is an investment into your business, $1,500 minimum commitment, and you can use that throughout the year for sponsorships and other items, and you can talk to the Chamber office if you're interested. But at this time, I'd like to recognize our Chairman's Circle members. So if you're here, just wave your arms or let us know you're here. We've got Casa Colina Hospital and Centers for Healthcare, Holiday Rock, Burtech Waste Industries, Doubletree by Hilton Claremont, Assistance Insurance Agency, Inland Productivity Solutions, LKQ Automotive, Moga Law Firm, Ontario International Airport, Care for Women's Medical Group, La Via Bella at San Antonio, Wright Family Trust, Chino Commercial Bank, Cornerstone Commercial and Personal Insurance Services, Langwasser and Company Inc. CPAs, Cutting Edge Builders, Family Foot Podiatry Center, Uptown Autocraft, Bridge Development Partners, Upland Collision Craft, Sinorama Ontario, I know David's here, I see him, Right at Home In-Home Care, there's Dan, and we've got Homebridge Financial Services, Dave Powers, Banner Bank, I saw Cheryl, Kessler Lair Insurance, Mike Donaldson, but he's no longer flying in his little airplane or jet or whatever you call it. American Financial Network, there's Amy, Main Street Garage, The Image Emporium, Dave Garthwaite, Southern California Edison, Inland Valley Recovery Services, Verve Weight Loss and Laser Aesthetics, and Red Hill Plaza. Thank you so much for being Chairman's Circle members. And is Peggy here?
Yeah.
Okay, Peggy, take it away.
Okay. Hi, everybody. I'm Peggy from Holiday Rock. I'm here to give your advocacy update. So recently we had our meeting with Inland Empire Chamber Alliance, and we went through a couple of bills, and two of them we ended up opposing. The first one we're opposing was AB 1253. This would retroactively increase taxes on small businesses. Also opposed SB 1399, which would place the burden on non-unionized employees. And then we also came to the decision to oppose Prop 15. This is the property tax, which would require the commercial and industrial properties to be taxed based on their market value. So if you go to the Upland Chamber website and you click on the advocacy tab at the top under more, you can see that we have three other tabs: letters, propositions, and Inland Empire Chamber Alliance. So under letters are all the letters templates we have that you can there's one that says open our business letter. I believe that's for Gavin Newsom, but we'll post up letters that you can print out and send to your state legislators and your supervisors. You know, if you want to support or propose any bills or propositions. And so we have all of our senators and assembly members and supervisors listed below. And then also under the advocacy tab is the proposition. So that was just the screen we were on showing Prop 15. So we can start putting up bills and propositions up there. And we'll put flyers up that can explain what each bill and proposition is about and help you decide how you would like to vote on that and what our suggestions.
Okay.
And then the last tab we have under there is Inland Employer Chamber Alliance. So if you click on that, that will show you an update of what we discussed at our last meeting that we had. So right there, you can see the bills we opposed, and then also at the bottom, you can choose to open up any of the letters and download them and send them off under your business if you'd like. And then I believe that's all I had to report. Just don't forget that the government relations is the second Thursday of every month via Zoom right now at 8 a.m. Last month we had San Antonio Hospital come in and speak and give us an update on hospital numbers and how they're doing. And again, if you have any questions, you can go ahead and reach out to them, and I'm happy to answer any concerns that you have. So that is all I have. Thank you.
Thank you, Peggy. Really, if you have not been to the EDF-GRF meeting, you are missing out on a fantastic meeting. We did have San Antonio Hospital there. They analyzed our mask situation. I had to show them what we had, and they gave us advice. So please do try to attend. So now it's time to announce our Ambassador of the Month. Our Ambassador of the Month this month is Anis Ahmed from the Ahmed team, Caldwell Banker Blackstone Realty. So if our legislators would like to present, are we doing that? Yes.
We'll start with our mayor.
There we go.
Good morning, everyone, or afternoon, whatever it is now. Anis, I am so thrilled to have you back in the chamber and working as hard as you do. You are quite the asset to the chamber, and we couldn't do it without you. So thank you very much, and congratulations on being Ambassador of the Month for August.
Thank you. And now we'll move on to Supervisor Hagman's office, Suzette Dang.
Okay. Okay. So on behalf of Supervisor Kurt Hagman, we would like to recognize Anis for August Ambassador of the Month. We want to congratulate you and thank you for your service for the Upland Chambers. We do have a beautiful certificate, and we'll make sure that we will mail it out to the Upland Chambers so that you could have it on hand and display it proudly.
Thank you very much. I appreciate that. Thank you.
Thank you, Anis.
Yes, thank you very much.
Thank you all. Thank you. Thank you for having me. I appreciate that. Thanks a lot.
So now we'd like to move on to our presentation from our sponsor. Thank you so much to our sponsor, Insurance Agency de Aragon, Anthony Aragon. Take it away. And anybody who has questions, just raise your hand.
Hello, I actually have a quick presentation for you guys. Thank you for allowing me to sponsor. I've been with the Upland Chamber for 5 years, and it has been a great experience to be part of it. So I am a health insurance and Medicare broker. And so that's, oh, next, let's go to the next slide, please. All right, so here's some of the services that I do offer. Medicare, if someone's turning 65, we can help them throughout the year. But the big push for Medicare starts on October first where we could start talking about the upcoming plans that are rolling out. And then we could start enrolling those who like to switch their plans starting October 15th through December 7th. Health insurance, that coming up in the fall as well, open enrollment. Now, there are some special enrollment periods that we could sign someone up throughout the year. COVID has been one of the biggest special enrollment periods. It is still ongoing. So if you know someone that has not signed up for insurance yet, we can still get them signed up under the COVID special enrollment, and Medi-Cal as well. Someone low income, let's help them out. Next slide, please. All right, so I serve those who are turning 26. They're typically falling off their parents' health insurance. So I could help them navigate the health insurance field and explain to them what it'll look like for them. Maybe we could qualify them for some subsidy through the state. So that is an option available to them as well. Seniors turning 65. We have a 7-month window that we could help them sign up for Medicare through Social Security and then get them on a plan that benefits them most with their doctors of networks and also their prescriptions as well. Those who recently lost coverage due to loss of employment, spouse got on Medicare, or they've never had insurance, I could help them as well. And then loss or decrease of income. Some people are losing hours. They're actually losing their job. So again, we could help them because their household income is decreasing. That's a special enrollment. So I could help them get individually or their family onto a health insurance plan. I really enjoy working with self-employed business owners because they have something called an adjusted gross income. And I can help them leverage this for health insurance so that way they can put more resources back into their business. Next slide, please. Okay, so Medicare, every year I have to take a federal test. It's called AHIP. It is required to pass with the 90. Fortunately, I passed with 100. Super excited. So here are just a list of some of the carriers that I am contracted with. Again, I have to certify with them. And I love these certifications because it's all geared towards protecting seniors. And I'm a huge advocate of senior protection. Next slide, please. Okay, I will be offering a Medicare 101 class each Wednesday. And if someone else says, you know, I can't make the 6 o'clock, I could schedule a personal one-on-one Medicare with them as well. Yeah, and just ask me for the link and then I'll get that all set up for them. Next slide, please. Trying to stay within my time frame here. So who knows seniors? These are the typical industries or individuals who have seniors as clients, or ask them, hey, do you know someone that does health insurance? Do you know someone that does Medicare? So first off, we have financial planners. They're typically planning in advance what it'd look like for them to retire. So we could give them current figures of what that would look like on the Medicare side. Property and casualty agencies who don't offer health insurance or Medicare. This is home and auto insurance. I know they are being asked, do you do health insurance? Typically they say no and send them to Google. I'd love to be that resource that they send them to because I highly educate the client so they make a well-informed decision. Doctors, love to reach out to those doctors who have patients turning 65 as well. Next page. Senior communities. I could do Medicare 101 presentations for their communities. If they need a resource, maybe their prescriptions are getting really expensive with the plan, we could reevaluate the plan and see if there's a better plan for them. Tax preparers. They're working with self-employed business owners, and I really love working with the tax preparer because now we're strategizing with health insurance. So it really benefits them most. Also, they're working with seniors' taxes as well. And finally, baby boomers. Baby boomers are not the ones that need the Medicare. They may be managing their parents' Medicare. And if that's the case, more than likely, they may be confused about this whole thing. So I can make it super easy for them. help them understand, walk them through all the steps. Next slide, please. Thank you. Okay, this is a quick story about me advocating for seniors. Social Security told one of my clients that they did not qualify for Medicare. He has been disabled for over 2 years. And I right off the bat, I was like, he is qualified. And then I was like, well, let me double check. So I did some research. I asked my team. Unanimously, we all said, yes, he qualifies. So we had him resubmit his paperwork. Again, they told him no. So we're still like spinning our wheels. Like, there has to be a reason why. They call him back 2 days later. We're sorry. We made a mistake on our end. We were able to get him onto Medicare, get him his scan program that he really, really wanted, because it was going to save him and his wife hundreds of dollars a month. So we advocate for our seniors. We really want them to save, because I know some, when they get into retirement, their income is very limited. And I don't want them wasting anything on something they don't have to. Okay, next slide. Yay, okay, so that's all I have for you guys today. My phone number is 909-641-3127. Feel free to text me. Say, hey, Anthony, this is so-and-so. I have a resource for you. I have someone looking. I'd love to make a connection for you. I would appreciate it, and I know your clients will appreciate it too. Thank you so much, and I hope everyone enjoys their lunch.
All right. Thank you, Anthony, very much. I will be calling you because I want to go over my mom's. Yeah, definitely. So now I'd like to introduce our guest speaker. We have Filiberto Quintero from the U.S. Department of Labor, Wage, and Hour Division. Filiberto has worked for the Department of Labor, Wage, and Hour Division, WHD, for the last 9 years. 7 of those years as an investigator. Ooh, fun job. Currently, he is working as the Acting Community Outreach and Resource Planning Specialist, CORPS, for the West Covina District. As part of his CORPS duties, he offers presentation to the community regarding the different laws enforced by the WHD. Take it away, Filiberto.
Excellent. Thank you very much. I appreciate that. And thank you for the great introduction. And hello, thank you very much for having me here at the Chamber of Commerce of Upland. It's first time I do, I think, a presentation with your Chamber of Commerce. I do try to reach out to many. I hope to continue to be able to reach out to this Chamber of Commerce to get more presentations going. I really wanted to show this presentation because we have the new law, the Family First Coronavirus Response Act, and this law is, there's a lot of knowledge that's not out there yet with this new law for all, employers and employees alike, and just the community in general. So we're trying to push this as much as we can to the different community members out there so they can get all the information that they need. The information that you'll be seeing here is going to be available for download or to disseminate. I have given this presentation to be shared. And it's also available, if you can see on the bottom right corner, you'll see a phone number and a website on the presentation. And that website is where this presentation is also available and all the information that I'll be providing. We could take it to the next slide, please. And this is a quick disclaimer. The disclaimer is basically saying that this is information that we'll be presenting for general information and not a legal opinion. So basically, it's just to try to get this information out to the public. If you are looking for the actual legal opinions, it would be at the Federal Register of the Code of Federal Regulations. That would be the sources. Again, it's also available through sites there at the Department of Labor website. We could go to the next slide, please. Excellent. So as I was talking, this law is brand new. It was just signed into law this March, the 18th of March that just passed. And it has a two-part section. The first part is the Emergency Paid Sick Leave Act, and the second portion is the Emergency Family and Medical Leave Expansion Act. They each have their own unique ways of having, how should I say, their own unique little ways of seeing eligibility and the way that they're applied and I'll be explaining that as we go forward. This law took effect on April 1st of this year, and it expires on December 31st of this year. That is the length of this law. There has not been an expansion past December 31st. Many people ask that. It is not something that is has been expanded yet. So it is enforced by us, the Wage and Hour Division of the Department of Labor. Go to the next slide, please. So this is a little bit of what I'll be covering. I'll be covering what coverage or who is covered under this act, the employees that would be eligible and how those eligibility, what those qualifying reasons would be, right, for the eligibility. And the number of weeks and hours that of leave that should be available to those employees. It depends really on what part of the act that is. And that also would, depending on what reason they're using for leave, would determine what the calculation of pay is. So I'll be looking at explaining all of those portions of this in the presentation. We could take this to the next one. I think it would start with the coverage aspect of it. Next slide, sorry. Excellent. So this is what we mean by coverage, is who is covered, right, under this act. And this is a coverage for all private sector employers that have less than 500 employees. This includes nonprofit employers that have less than 500 employees. So all of those private sector employers with less than 500 are covered. Anybody that has 500 or more are not covered under this act. They are exempt of this act. So it depends on where you fall as an employer if you're covered or not there. Also, public agencies, regardless of the number. So when we talk about government employees, that's what we're talking about, government agencies. So the cities, counties, states, in some cases federal as well. So this is who is covered under the law, under these different sectors. We could take the next slide, please. And this is how do we determine the coverage. It depends on how you count these employees. So this is a way to clarify what that means. How do we count these employees? So the employer does not count employees that are outside of the U.S. territories or the District of Columbia. So if you have employees outside of that realm, they're not included in the count. But if you have employees that are within these territories, then they are part of your total count. And it is a count of employees across the entirety of the U.S., including these territories. And it does include the full and part-time employees. They're all counted. And the employees that are working and on leave are counted. So it's even if the employees are not there at the moment, but they're still under your books, I guess, as an employee because they're out on leave, say that it's a personal leave or something to that effect, they're counted. This is the unique one here is temporary employees that are jointly employed are counted. So if you're using a temp agency and you are jointly employed means that you have some kind of say in their employment, right? Giving them some form of direction, that type of thing. There's a joint employment aspect there that has to be met. But if we see that they're jointly employed, then yes, they are counted also as part of the number of employees. Day laborers that are supplied by the temp agency are counted, and the count is made when the employee is asking for the need for this leave and for the reason that they need it. So when that request is made, that's when you make this determination on whether or not you are covered as an employer under this law. If we could take the next slide, please. Okay, so we're going to go over the qualifying reasons. These ones are not numbered. I'm kind of used to the numbered ones. So I usually talk about 1, 2, and 3, which is what I'm looking at right now. So if I say a number, I'm kind of referring to these by number, and I apologize because I'm kind of used to that. But the first one here, what I call number 1 is the first qualifying is that they're subject to a federal, state, or local quarantine or isolation order related to COVID-19. So I'm trying to think of examples of these. I can't think of any that are in the area currently, but let's say, for example, that somebody worked in Upland, but they lived in Ontario and they commuted. But Ontario, for some reason, has a local quarantine where they said nobody in Ontario can leave their home. you have to be quarantined to your home, so you can't even go out to work. You're quarantined within that location. Like Hawaii, I think if you travel to Hawaii, you're quarantined for like 14 days before you can even go out into the Hawaii if you fly in. So that's an example, I think, of a current quarantine that I can think of. But if they're in Ontario and they're quarantined and they can't go to work and the job is still, an Upland is still up and running and they have the work available for the employee, then that would be somebody that would be like under a local quarantine, as an example. Isolation order could be like a cruise ship that's been put on an isolation order or something to that effect. So those are examples. I can't think of any current ones in our area. The only one I can think of is maybe the one in Hawaii where you're asked to quarantine for 14 days as you arrive to Hawaii. The second one is that the healthcare provider has advised you to self-quarantine. So if that healthcare provider said, hey, you need to set yourself aside and not expose yourself to the public or have the public exposed to you, vice versa, maybe you're a high-risk person. So if that healthcare provider is advising you to self-quarantine, there again is a qualifying reason. A third one is that you're experiencing COVID-19 symptoms. I got a fever or one of the different symptoms of COVID-19, and you're seeking a medical diagnosis. That's another reason that I could qualify for this type of leave. It's based on the COVID-19 symptoms and that you're seeking medical diagnosis. It matters not the outcome of that diagnosis. If it comes out negative, but you were experiencing symptoms and you're seeking, it's still a qualifying reason. If that person turns out to be negative at the end of this, it doesn't have to be a positive test. Or in any of these situations, it doesn't have to have a positive outcome. They're being asked to quarantine in those cases. Let's go ahead and take it to the next slide, please. This is what I call reasons 4, 5, and 6. And 4, 5, and 6 are now related to people that is not a personal, like you personally asking for or being affected. This is when you're usually caring for somebody else, right? Well, except for number 6, and I guess I'll explain that in a little bit. So number 5, for example, is caring for an individual who is subject to reason number 1, the federal, state, or local quarantine or isolation order, or somebody that has been advised by a healthcare provider to quarantine for reasons related to COVID-19. So if you're caring for somebody that's been asked to quarantine or a healthcare provider told to quarantine, you also can be covered as a qualifying reasons. The 5th reason, reason number 5, this is the one that kind of carries into our second part of the law. It's a little bit more unique, is when you're caring for his or her child, meaning your child, whose school or place of care is closed, right? So they're no longer available due to COVID-19 reasons. So if the school and place of care is closed, right now that's a big one because a lot of people's schools have closed and they're homeschooling for the most part. So if they don't have somebody to care for the child because they closed and they don't have anybody else that can take care of that child, that they usually have to take care of, then that could be a qualifying reason. This is an important one because it kind of falls into both parts of the law, and I'll explain that again a little bit further on. And then the 6th reason is if the person's experiencing any other similar condition, substantially similar to, I guess, COVID-19, that's been specified by the U.S. Department of Health and Human Services. To my knowledge, up to the moment, we haven't had any other outbreak of anything outside of COVID-19 that's substantially similar that has been deemed this way by the U.S. Department of Health and Human Services, but it's here in case it is. So that's reason number 6. So this is 4, 5, and 6 of the reasons. Let's go ahead and take it to the next slide, please. Oh, and these might repeat down the road, so I might just kind of breeze over them as we move along, by the way. Now, there is what they call a small business exemption for small businesses with fewer than 50 employees, where it comes to reason number 5 only. The reason number 5 that I was explaining before is when the employee is asking for leave to care for his or her child because of the school or place of care being closed. But only if the requirements of the FFCRA jeopardizes the business viability, which is very, very, very important. It has to be something that jeopardizes the viability. It's not just all employers with 50 or less employees or fewer than 50 employees that qualify automatically. It has to be only in the cases where it jeopardizes business viability. I'll explain a little bit about that. If you could take the next slide, please. So here is the application of this, right? The exemption applies. It's determined that if the leave would result in expenses or financial obligations exceeding available business revenues and cause a small business to cease operating at a minimum capacity. So if your business would be unable to run, right, to operate because of the letting of somebody go on this leave, that would be one. And this is something that if we were to come and do an investigation, we would ask you to show us how one of these reasons would apply in these cases. So it's an or here. So one of these three reasons would apply for you for your exemption. The second one is that specific employees' absence would entail substantial risk of to the financial health or operation capabilities of the business because of that specific employee's, right, specialized skills and knowledge or responsibilities. So if that specific employee, they say you have a very special machine that they only know how to operate, and that's kind of like the heart and blood of the business. And if they go, that machine would not be able to run, and that would probably keep your business from running. And they need to take this leave for only reason number 5. Then in this case, that's when that person can be denied that, right, because of this exemption. And then the third one is when there is insufficient employees that are able, willing, and qualified at the time and place needed to perform labor or services provided by the employee, and these labor services are needed for the business to operate at a minimum capacity. So if you have so few employees that you can't even operate, in cases like, I can think maybe like a daycare, we have to have an employee to take care of the children. I don't know if there's some type of ratio or something like that, but there are cases where if they just are unable to work at all, you won't be able to have the children cared for at all. The business would cease to operate at a minimum capacity. So this would be where you can also say no, right? Where you say that you would be exempt. And again, this is only for reason number 5, as I mentioned before, which is if they're asking for this because of the fact that the school is closed or the place of care is not available, and they're asking for this leave. Any of the other reasons does not fall into this exemption. They still are able to take that leave if they're using any of the other reasons besides reason number 5. That's the only thing that would be exempt. And I'm going to review that. I'm going to probably emphasize that down the road because it's going to be part of our last part here. Let's go ahead and take the next slide, please. So this talks about exclusions from the Act. So there are some that are not included in the Act itself. The Act excludes or exempts healthcare providers or emergency responders from being able to take part in the Family First Coronavirus Response Act. I know that there's been some talks in the courts about that, but we haven't gotten any direction yet on what those decisions are. So we haven't made any changes to date that I'm aware of on this decision. So there is an exclusion to healthcare providers or emergency responders. And I can clarify a little bit more if you go to the next slide here, what the definition is, right? So for a healthcare provider, it is anyone, and that's anyone. It can be anybody in the office, including a doctor's office, hospital, healthcare center, clinic, post-secondary education institution offering healthcare instructions, medical schools, local health department or agencies, nursing facilities, retirement facilities, nursing homes, and so on and so forth, right? Healthcare provider, home healthcare providers, any facility that performs laboratory or medical testing, pharmacy, or any similar institution, employer, or entity. So if the healthcare provider is anybody that's similar in all these different types of businesses, then they would be deemed as healthcare providers. It's a very broad definition of healthcare provider for this one. And then the next one kind of defines what the emergency responder is. So an emergency responder is anybody necessary to transport care, healthcare, comfort, nutrition for such patients and others needed in response to COVID-19. This includes, again, this very broad: military, National Guard, law enforcement, correctional institutions, firefighters, medical service personnel for emergency medical service, right? Physicians, nurses, public health personnel, just the list, as you can see, is pretty extensive. So this is everybody associated with the medical response team. So if the business is in medical, I'm sorry, an emergency responder in this realm, then they would be also exempt because of their specialized skills in this particular area. And that's including, of course, it says at the very bottom, individuals who work in such facilities, employing individuals whose work is necessary to maintain the operation of the facility. So this is not just the actual responder, but the people that kind of support them within that facility. So these are the two that are excluded from the Act. There's the healthcare provider and emergency responders. Go to the next slide, please. Now, there is a requirement for employers to post a poster, and I believe I have the poster that I shared, and I'll be sharing that at the end here, not to mention some links along with the presentation. But there is a poster that must be posted, and it can be distributed online, you know, at the employer website or directly emailed to employees. If you don't have any other way to really post it. Normally, these are the posters that you would have in like typically I see them in like employee break rooms or near the restrooms or high visibility areas for employees. This is, you know, the poster that would be required to be posted, this FFCRA poster, and it is available again on our website in many languages, even though there is no translation required. If a particular language is needed, not just Spanish, they have other languages. I know it says DOL, Spanish, and English FFCRA posters, but I see them in many other languages. I want to say probably around 10 languages that I saw there, if not more. And that's all at that website that you saw at the bottom right corner, and also you can see there on the link. They're available at our website there. Please take the next slide, please. And so we're going to talk about the employee layoffs. So the FFCRA requirements are not applicable prior to April 1st, 2020. So if the business closes after April 1st, before the employee takes FFCRA requirements, they do not apply except for the days from April 1st to the date the employee is laid off. So it's only during the April 1st time period or when it closes. If a business is open and it lays off part of its workforce, employees who are laid off or furloughed are not entitled to FFCRA. So if they're laid off or furloughed means that there's no work available. This law is only for employees that there's work available, but they're unable to perform that work. And that's the reason for this law, saying, you know, even though the work is there, I can't perform it for one of these 6 reasons that we explained before, the 6 reasons that we were talking about. So that's the way the employees may not be covered if they are laid off or furloughed. We could go ahead and take the next slide, please. So let's talk about the first part of the Act, which is the Emergency Paid Sick Leave Act. This is the very first one that is the two-parter that we have for the Family First Coronavirus Response Act. Take it to the next slide, please. So as I spoke about before, there's 6 qualifying reasons, right, for the Emergency Paid Sick Leave Act that I mentioned before. If the person takes that leave, during the time that they're taking leave, then their health insurance has to continue during that time period, okay? And their entitlement is to be able to take that paid sick leave over a 2-week period. And this is for both full and part-time employees, and it's for up to 80 hours in that 2-week period. I think it's either this slide or the next slide. You mind clicking the next slide real quick just so I could see what that is? I'm trying to remember. No, let's go ahead and go back to 1 slide so I can kind of explain the full and part-time portion of this. So full-time employees is pretty easy. Any employee that works 40 or more hours per week are entitled to 40 hours a week for 2 weeks. That's the 80 hours. Part-time employees, it's based on their schedule. So if they're regularly scheduled to work, let's say 30 hours a week, then they would be entitled for 30 hours a week for 2 weeks, which is a total of 60 hours, is how that calculation is. Now, there are some cases where people have fluctuating schedules or fluctuating hours, and it's a little bit more difficult to determine that. Well, in those cases, then you would look at the previous 6 months and come up with an average number of hours for those employees. If that makes them a full-time employee, then they're entitled for the 40 hours per week for 80 hours. If they're not, then they're considered part-time employees, of course, and then you would use that average that you came up with to be able to make that determination. So this is a way to be able to calculate how many hours would be paid to those employees. It's probably something that I might be covering up ahead, but I'll go ahead and cover it now. So I'll breeze over it if I come up to that. For some reason, I remember this portion of the slide later down the road, but this is for that. And remember, it's a continuation of insurance during that time, and it's also something that's not said here. The emergency paid sick leave is separate from your current leave. So if you have a sick leave plan or program, it's separate from this paid sick leave. This is a completely separate set of leave. So it doesn't take away the leave that they have already. This is a leave that stands all on its own, the emergency paid sick leave. Okay, let's go ahead and take it to the next slide, please. Alrighty, so let's look at who is eligible, right? So in this case, it's for all covered employers. All employees who work for a covered employer are eligible. This is regardless of the amount of time they worked there. So if you just hired them yesterday, they're considered a covered employee under this law. Okay, so this is again talking about under what, which is the private sector employers, and that with fewer than 500 employees, which is a coverage, and of course the public sector employers as well. It talks a little bit more about the public sectors and who is, but that's more for the federal employees that are excluded in some of these cases. Let's go ahead and take it to the next slide, please. So this is just going over the qualifying reasons. Here they are numbered. This is what I usually like to say. I'm sorry, was there a question? No? Okay. So the 1, 2, and 3 that I talked about, so it's just going over the different qualifying reasons, 1, 2, and 3, which I talked about before, and then the next slide is going to show 4, 5, and 6. So go ahead and go to the next slide, and it's just the 3 other ones, which I already talked about, so I'm not going to review these over again. Number 5 is bolded because it kind of applies for our next portion of the leave, and also that's the one that has the exemption of it, so it's a little bit more special as reason number 5. Let's go ahead and take the next slide, please. So, here it is, see, the duration of leave. So this is where I was talking about how we come up with the number of hours is the 80 hours a week, and employees that have part-time, then it's the 2-week period for the normal number of hours. And of course, we spoke about that calculation that we would use looking at the previous 6 months. Now, if the employee doesn't have 6 months working there, then you would use the amount of time that they've worked there on average to come up with those average hours to be able to come up with that. Or if the employee is so new, like they've only had 1 or 2 days or very, very limited amount of time, then it's the agreement that the employer made with that employee at their hiring, right? By saying, hey, I'm going to hire you, and I'm going to have you working for, let's say, 30 hours a week. 30 hours a week is what our agreement is, and then that would entitle them for 3 hours a week for the 2-week period, a total of 60 hours. And again, this is in addition to any pre-existing leave entitlements. So this is not it's not where it takes away any pre-existing leave entitlement. Okay. Go ahead and take the next slide, please. Now let's find out what we need to pay, right? What is the required rate of pay? So if I'm an employee working at a company, and I am being paid the rate of, let's say, $15 an hour. If $15 an hour is higher than the applicable minimum wage, which is the local one, either state, county, city, or federal, which is well above the federal. So federal is still $7.25 an hour, by the way. That's our federal minimum wage. But if your regular rate is higher than any of the minimum wage, then the regular rate is the rate that you would be using to make the computation on what is paid for those hours. If the rate that you're being paid as an employee is under any of the applicable minimum wages, including the local minimum wage, like the state, then you would use the higher of the rates. Then you would have to use the state or local minimum wage I'm sure it would be higher than the, because California is much higher than the federal. So I think California might be 13, let's say. I think it's around 13. Don't quote me. I don't know the state law that well. But let's say it's around 13, then that would be the correct wage. If I'm being paid 10 for some reason, 13 is what should be used in that case, okay? And that's the rate, what we call the rate of pay or the regular rate that we'll be using to make a determination on what we pay this employee for the number of hours that they're due for that 2-week period, right? So if I'm due 80 hours, then it would be paid depending on this rate. And I'll show you what that calculation comes through in the next slide here. You could go to, thank you. And so it depends on the reason. So if you're using, like I mentioned before, it's nice when they're numbered. Reasons numbers 1, 2, and 3, which are restated here, right? The 3 reasons that you see there, which are more of the personal reasons. If 1, 2, or 3 are used as a reason for the leave need, then the employee would receive 100% of the rate of pay, or the rate that we were talking about previously. So if I'm being paid $15 an hour, I would be due $15 an hour for if I'm working full-time or more, right, for 40 hours a week for 2 weeks, a total of 80 hours. So I would be receiving the full $15 an hour, which is the required rate for that. There is a cap, right? There is a cap to that. So if I'm receiving so much more that it goes over the $511 a day, or $5,110 in total for the 2-week period, then I can cap it at that amount. Okay, so if the 100% goes of my pay goes over that, then the employer can say, you're normally paid $800, but we can't pay the $800. We're going to pay you what's required, which is the $511 per day. That's what the cap would be. Okay, there are some cases where that cap can come into effect. So this is where the there is some limit to that amount. Mind you, this is also money that's paid to the employee is is reimbursed through tax credit through the IRS, and IRS.gov I think has some info on that. So some good information, because it is something that's a tax credit to the employer when they pay the employees. Is this on IRS.gov? So we can go to the next one. Let's look at reasons now, number 4, 5, and 6. So 4, 5, and 6 is, again, the last 3 reasons, which are caring for somebody that has reasons 1 and 2 up there, or the child's school is closed or place of care is closed, right, due to COVID-19. So, or of course the substantially similar condition, which we don't have one currently, to my knowledge, hasn't been announced anything similar. If they fall into this one of these 3 reasons, 4, 5, and 6, then the calculation changes. The calculation would be at 2/3 of the amount of pay that would be required. So if my rate of pay that we calculated again was at $15 an hour, and then I would do 2/3 of that, which in that case, easy math, right? It would be $10 an hour that would actually be paid. That's the 2/3 rate that I would be paid for the number of hours that I would normally work, which if it's full-time would be 40 hours for the 2-week period. So 10 times 4, what, 80? Oh, easy math is $800, I want to say. I could be off on that. Hopefully it's 800. Trying to do math in my head's not always quick. But so it would be like an $800 due for the 2-week period in those. Again, this one does have a cap. I've actually talked to people where this cap has come into effect because it's a much lower cap than the previous one of $511. For reasons 4, 5, and 6, the cap is at $200 a day or $2,000 total for the 2-week period. So in some cases, I've spoke to people who are making like $3,000 a week, you know, for their normal work week. So this one limits it to a cap of $2,000 total for the 2-week period, which is about $1,000 a week. So it really limits some of these, even if you take them down 2/3 of their pay. So this is what the calculation used would be in these cases. Okay, let's go ahead and take it to the next one. I think it takes us into the next portion of this. Yes, the Emergency Family and Medical Leave Expansion Act. So we talked about the Emergency Paid Sick Leave Act, which is part 1. Now, Emergency Family and Medical Leave Expansion Act is the second part to the FFCRA. If we could take it to the next slide, please. And so this benefit here is only for reason number 5. Reason number 5, which is the care for his or her son because of the place of care or school being closed, and there's no other person to be that's able to care for the child due to COVID-19 reasons, then this benefit is available for them for that reason. And so this is where any of the other reasons doesn't come into play for the second portion of it, only this one reason. And if this is the case, then the employee who is requesting the Emergency Family Medical Leave Expansion Act for reason number 5 is entitled for up to 12 weeks of job protected leave and with the continuation of health benefits. So it's up to 12 weeks. Now it states here the initial 2 weeks are unpaid, and then the remaining 10 weeks are paid at 2/3 of the employee's regular rate. Like I mentioned, for that $15 rate, it would be paid at $10 an hour for that 10-week period. For the average number of hours, if I'm paid at 40 hours a week, that would be for the 10-week period at 2/3 pay after the initial 2 weeks that are unpaid. Now, the initial 2 weeks that are unpaid, the employee can use those unpaid weeks under the previous act we talked about, which is the Emergency Paid Sick Leave Act. So those initial 2-week periods are still able to be paid under the first portion of the act. Now, if the employee already used the Emergency Paid Sick Leave Act for any other reason, all right, let's say that I was asked by a healthcare provider to take 2 weeks to quarantine back in May, and so I took my 2 weeks and I was paid that benefit. And then come, September or August, I think is when they start now for the children to go to school. Their school is closed, right? The place of care is closed, and I'm not able to take them there. They're home. Then I would need it again. Then in those cases, the 12 weeks are still available for me. That's job protected leave, but the first 2 weeks then would be unpaid because I've already used that emergency paid sick leave benefit. So it would be 2 weeks unpaid, and then the remaining 10 weeks at 2/3 of my regular rate of pay. So that initial 2 weeks can be paid if you have not used the Emergency Paid Sick Leave Act for that specific employee. Okay, so that's that initial 2-week period. Is a little bit tricky there. Go ahead and take the next slide, please. And so who is eligible, right? This is a little bit different here also. It's not just an employee that you hired very recently. For an employee to be eligible, they must be employed by their employer for at least 30 calendar days. So, and again, it goes over what the coverage is with private sector employers, nonprofit employers that are employing fewer than 500 employees, and of course, the public agencies. So this is all employees that are covered that have worked for the employer that meet this coverage for at least 30 calendar days. So if I needed it on April 1st, I should have been hired on, if I do my math, I think it's March 2nd. Is it 31 days in March? March, yes. So March has 31 days, so I had to have been an employee on March 2nd to have been able to take it on April 1st, if that's my need, right? So if you look at it, they have to be employed 30 calendar days. Now there's some caveats to this as well. If the employee was working as a temporary employee for a company previous to, and then they got hired as a permanent employee for the company. Right now they're working for the company directly, that versus a temp agency. The time they were working for the company under the temp agency counts towards the time that they're working with the employer. So that's brought into it. So if they were working for that company as a temp, it's brought into that time for the 30-day calculation. If I was laid off or fired, right? Let's say I was let go on April 1st, and I'd have been an employee there for the last 6 months, and then come now August, it's the busy season, and hey, we need you back, Filiberto. I need you to get busy again. Would you mind coming back to work? Now to be able to see if I'm qualified for the period that I was working previous to laid off, that's when you look at that time period 60 days back, to see if I was hired at least 30 days, 30 calendar days during that time. So that time counts from the time I was laid off to the time I'm previous, if I'm rehired down the road. We look at the time previous to that to see if you worked 30 calendar days. That goes for furloughs and layoffs and people that were fired that are brought back type of thing, okay? So there are some caveats on that 30-day calculation when it comes to to that, just on those special scenarios. And of course, we're always available. You know, the phone number, again, you can see it down at the bottom right. So if you still have those questions or things when they come up, you're, of course, welcome to call us anytime. Be happy to clarify. Go ahead and take the next slide, please. So the qualifying reason for leave, as I mentioned before, is only for the employee who cares for his or her child because of the child care provider being closed or unavailable. It's just reiterating it again. But this is the only qualifying reason for the Emergency Family Medical Leave Expansion Act. Let's go ahead and take the next slide, please. This is, I already explained this also. I'm kind of getting ahead of myself. This is explaining the unpaid portion versus the paid portion. So it talks about how the first 2 weeks are unpaid and then the following 10 weeks are paid. And it talks about the 2/3 and still the same cap of $200 a day or $10,000 total for the 10-week period. But in the first 2 weeks, as I mentioned before, it talks about an employee may choose to use paid sick leave under the Emergency Paid Sick Leave Act. Or they can use accrued paid time under the employer's benefit package at the same time as they're using unpaid EFMLEA leave. So that's when they can use their own personal time for Emergency Paid Sick Leave, Emergency Family Medical Leave Expansion Act is when they're doing the unpaid time. They can use their personal leave for that. But this is kind of explaining also the first 2 weeks being paid under the Emergency Paid Sick Leave Act that I mentioned originally. Let's go ahead and take the next slide, please. So Emergency Family Medical Leave Expansion Act is an expansion of the Family Medical Leave Act, more or less. It's a little bit different on the coverage and the qualifications, but it is meant to go a little bit hand in hand. So if somebody, like let's say I am in need of FMLA for reasons not related to COVID-19, right? Let's say I have a condition that I needed to be out on FMLA for 6 weeks in this FMLA calendar year. And so I've used 6 weeks of FMLA. And then my the school is closed and my child can't go to school. So I have to care for my child. I asked for EFMLEA. I'm not entitled to the full 12 weeks anymore because I've already used 6 weeks under FMLA. Then I would only be entitled for 6 weeks of Emergency Family Medical Leave Expansion Act. So that's where the FMLA is going hand in hand with the EFMLEA. So if they've already used, let's say I already used my 12 weeks, then I would not have any available, and that's what this is stating here. I used my 12 weeks already back in March or April in this FMLA leave year, then I would not be able to take that time off under EFMLEA because I've used that time already. So that's how they interact one with the other with the FMLA. So it's not in addition, it's kind of a more hand in hand. I don't remember what the word is exactly, but they went congruently, I guess you would say, with each other. And I think the next one takes us to our links for the next slide. Oh no, sorry. Talks about the temporary non-enforcement period. This is from our early portion, right? There was a non-enforcement period that we had from March 18th to April 17th of 2020 when we first enacted. So so they were, if the employer was seen that they violated, it was if they were reasonably and in good faith acting to remedy the violation, that the violations were not willful, then the DUO would receive a communication from that employer to comply with the act going forward. But this was during our non-enforcement period, which we currently are not in. We're in a full enforcement period currently. So if there is a violation of the FFCRA, then the employee can reach out to us, and in these cases, we do go ahead and investigate the issue, and it's not in a non-enforcement period anymore. So this has kind of gone by already, so not something that is applicable at the moment anymore. Go ahead and take the next slide, please. And these are our resources, and these are all links to our website that we have for all the different portions of this act, and they're available. Some of them you can see are available in Spanish. Our poster is available in Spanish and many other languages, so it's not just in Spanish. We also have at the bottom there an email address that you can see for any COVID-19 related questions when it comes to the wage and hour division, specifically with this FFCRA. So you're welcome to ask questions there. We also have a questions and answers section in our website that has a lot of our questions and answers currently being asked. It's up to 90 some questions. It might be more now. Off the top of my head, I remember it being in the 90s of questions that have been answered since then. So those are the different resources that would be available. And again, you'll have that available when they share the presentation with everybody, if you don't mind. The reason I wanted to share this is that August is considered Breastfeeding Awareness Month, and we also enforce the Nursing Mothers Act when it comes to nursing mothers under the the FLSA of our act. And so because of it this month, we'd like to talk about this specific act, and this is where employers are required to have a space available. Here's the poster. Break Time for Nursing Mothers is the name of it there. And so this is where employers are asked to have a place, provide a place that is functional to express milk for the nursing mothers for the first year of that child's since the child was born. That is shielded from view, free from intrusion, available as needed, and not a bathroom. You can see that that's very, very bold in there. There are some caveats there for people that have less than 50 employees and that can demonstrate that they can't comply. Then they does not have to provide the nursing breaks, but they would it's not automatic again. They have to demonstrate that it is not able to comply for that. But this is just another poster talking about break time for nursing mothers, which is an important thing. You know, sometimes when the mothers do not get the breaks needed to express milk, then they lose the ability, and that affects the the child's growth and everything else. So very important act to have. And it talks about unlawful acts at the bottom. So anybody that's brought a that's discriminated against or in other way in other ways affected because they put in a complaint or anything like that where we did an investigation, as we see that as kind of a retaliation that is against the law. So something that we see that way. So something to be careful of if somebody does put in complaints, that we try to remedy for them. And that's not just the case for the break time for nursing mothers, it's for any of the acts that we enforce, which are many. And I hope to be able to speak to you. So, hey, thank you so much.
Definitely. Well, thank you very much, Filiberto. We appreciate your presentation.
Absolutely. I tried to rush through there real quick, and normally it take about an hour through all of this, and go. But I know that time is precious here. So I really appreciate the platform and the time. I hope to be able to speak with your Chamber of Commerce again here in the near future on many of our other laws. We have the child labor, we have the, of course, the Fair Labor Standards Act, and many, many others. So I'd be happy to present if there's any questions on any of those as well, or even repeat this one if needed in the near future if it's a request to do so. Okay?
Thank you so much. We really appreciate it.
Thank you.
Very good.
All right. Thank you so much. Thank you, everybody.
And I see Stephanie Rose popped on in. She'd like to present to Anise for the Ambassador of the Month. Are you there?
I am here. Hi, good afternoon, everyone. I had to log on a little bit late because I had a conference call run longer than expected, and I'm sure many of you can relate to that. But I'd like to congratulate Anise on being named Ambassador of the Month on behalf of Supervisor Janice Rutherford. Our office has known Anise for many years, and we are very grateful for his involvement in the community and his willingness to serve. So Anise, thank you for your dedication and congratulations.
Very good. Thank you.
What you all to be asking about is about our One Club Challenge, which is happening on September the 4th. That's on Monday. It's $99 to golf. We're doing a One Club Challenge, and we've kind of made up our own rules for this with the help of Dan, a real golfer. And really, you're going to pick your golf club. You're going to play the hole. When you get to the green, you get to actually use your putter. So really, it's 2 clubs per hole. Some people got a little scared about coming out, but I mean, it's a great time. First place and last place go home with prizes. You get a nice box lunch from 1906. So come on out for $99. We've got 24 spots open, and we'll have a full field. So chamber fundraiser. We're looking to make some money.
All right.
Yeah, keep us employed so we don't have to call Phil.
All right, and I would like to remind you of the annual installation dinner and business awards. That's October 27th. It is going to be so much fun. It's going to be a high roller event. So bring your sparklies and all that jazz. So should be very fun. It's at La Via Bella at San Antone. So we'll see you then.
I just can't wait to find out who won some of those top awards. So.
Yep. Large business, small business, nonprofit, and business person of the year. So we are very excited about that. And thank you everybody for attending. I'd like to give you my closing little quote. Try to make it all, it's not about gambling because like I told you last time, those quotes are like Gamblers Anonymous quotes. So nobody wants those. So mine is about taking a chance. If you don't take a chance, you don't stand a chance. I like that. I thought that was pretty cool. So go out there, take your chance, have a wonderful weekend, playing you out with the gambler.
Hi, everyone. Have a great weekend.
Hi, all. Good to see you.